Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. Brad Heineck, physical therapist.
Hi, I'm Chris the Pharmacist.
And I'm exactly one half of the Bob and Brad physical therapy channel, but Bob's not here today because we have somebody better. We've got Chris. We're going to talk about Advil, everything you need to know if you want to go learn the basics of it, and some details, how much you take, etc. Won't take very long. We do have a giveaway I want to talk about. This is our wall anchor. You're going to get 4 of them to a set. You can put them on the wall like we have over here. We'll get a little pan shot there, and we have a brief example of how to use it. You have to have wooden studs in your house, what most houses do. Mount it in per directions and lock on your tube and go ahead.
Do some W's?
Yeah.
All right.
I wouldn't do it like this, so make sure you put it into a real wall.
Yeah. That's
it works much more.
It's going to be a rough face shot, that's for sure.
Okay. All right, Chris, let's talk about Advil. What is it?
Advil is ibuprofen, so also known as Motrin. So it's been around for a long, long time.
That's the same thing.
Yeah, Motrin, Advil, ibuprofen. All 3 are synonymous. So
Okay.
I usually just use ibuprofen because it's the easiest thing for me to remember. The reality of it comes as a 200 milligram tablet, comes as a liquid form for kids or people that can't swallow well.
When kids, is that 12 and under?
Yeah, you can use it. Yeah, I mean, you can use it as low as well, really a year or less, depending upon, because we'll use it for fever reducers for kids. So if they've been really sick, we dose it down to their body weight. So it's not going to be just a package. I mean, the concentration that ibuprofen comes in liquid form is 100 milligrams per 5 milliliter. So it's that point. So we find, let's say, use
is that kids as in infants?
Yeah, babies.
Yeah,
so if you're going to dose it down and you would tell us the child's weight, we would calculate out the proper weight and give you a dose. So either talk to your doctor, your nurse, or your pharmacist to get the appropriate dose. Sure. Sometimes, they get a vaccine, they're uncomfortable, they got an ear infection going on, really feverish, uncomfortable. So you provide the ibuprofen, reduces it. So in absence of an allergy, which would be one of the reasons we wouldn't take it. So it's got cross reactivity with aspirin. So if you have an aspirin allergy, definitely don't want to use ibuprofen unless your doctor's kind of tested you and given you approval to safely use it.
And that's all ages?
All ages. Yep. That's forever and ever.
It's good to know.
Yep, you bet. But the other utility for adults, and the cool thing about ibuprofen, it works for pain, it works for fever reduction, and its biggest utility is it's an anti-inflammatory. So it works for pain. So you got the sprained ankle, you got the bum knee, the bad back, you got the headache, or you got a cold, fever, COVID, whatever. You got you can use it.
So swelling is the inflammation.
Yes. So it's going to help to contain that. So because oftentimes that's a byproduct of pain. You got all that. Let's say I blew my knee out, swelling here. It's stretching, it's pressing on those nerves, it's uncomfortable. If we can reduce some of that swelling, obviously with ice and other things too, but the ibuprofen is going to work from the inside out, try and give you some comfort and some pain
Take
relief.
that pressure off.
Take the pressure off, but it also analgesic. So not only is it reducing the inflammation, but it's telling your body, hey, I don't care as much about the pain. So you're a little bit more comfortable so you can rest and allow your body's natural healing capabilities to kick in.
All right.
So dosing.
Dosing, yeah.
Yeah, dosing. So it comes as a 200 milligram tablet. So basically 12 on up, it's going to be 1 to 2 tablets every 4 to 6 hours apart as you need, to a maximum of 8 tablets in the day. Oftentimes doctors may suggest it because it's a 200 milligram tablet, they'll tell you to maybe take more per their guidance.
Sure.
So oftentimes you'll hear that from physicians to say, just take this, but we're going to have you take a little bit more. But the maximum dose that we really don't want people to do is just 2 tablets every 4 to 6 hours apart. 8 in a day is kind of your max because we want to protect our stomachs. One of the side effects of this, actually, of long-term use of ibuprofen, is stomach ulceration. So we do have to be careful with that.
What's long-term considered?
Well, it's going to be, months of regular consistent use. So let's say you've got osteoarthritis. Sometimes people get a lot of pain. It's the wear and tear arthritis. So as we age, I'm just picking on it, but it's something that we would use probably for more than just your average bear because it doesn't go away. We haven't invented something to fix that yet.
Managing it.
Yeah. So, and that way I would see you for physical therapy to try and come up with other ways to go non-drug. But in the short term, we would like it. But if you're using it all the time, there are some risks to the stomach. There are some risks to the kidneys. So we do have to be careful. And the other unique thing for people with ibuprofen, if you're on blood thinners, it's an absolute no-no. So if you're taking drugs like warfarin, Eliquis, Xarelto, Brilinta, clopidogrel. These are all things that your pharmacist would tell you and your doctor would tell you that you cannot use anti-inflammatories like ibuprofen.
All right.
It can be dangerous. It can cause the bleeding stroke, which are the 3% survivability on a worst case scenario. It's not an area we want to go in.
Right. Okay, that's really good information.
But
to know.
for pain and inflammation, it's my favorite go-to choice for recommendation to patients. So if I'm not checking off kidney problems, blood pressure problems, blood thinners, or allergies, it's my go-to choice.
Sure.
So
okay.
You're going to come in to see your pharmacist or your doctor, and they're going to tell you, any problems? No. Go through our list. Okay, why don't we try some ibuprofen?
So as a rule of thumb, I mean, if someone has an acute problem, they use it 2 times, 4 times a day, 3 to 4 times a day. How many days in a row?
Yeah, we would say up to 7.
Okay.
So that's kind of that benchmark. And if you're getting worse while you're taking it, or if you get to day 7 and things just haven't improved, it's definitely time to contact your doctor. We have to get the pros in there that can really figure out maybe the crux of the matter to ensure that we can get you back to well.
Right. In case there's something else going on.
Exactly.
It could be more serious. Go ahead.
Tough on the tummy. So you always want to take it with some food or at least a glass of milk.
Before or after you eat?
I would actually have it after you eat. So this way we got something in there. It's not so much that it's acidic and it's going to burn a hole in your tummy. That's not what happens, but it reduces prostaglandins. It slows down the absorption, helps your body to kind of pick it up and make sure it's minimal.
So whatever as long as you eat something.
A little something is kind of how to take it.
And if you're in a big hurry, I think you've told me at least got to have some milk.
At least milk, and we'd like you to stay hydrated because it likes to go through those kidneys. So we do want to take care of that. So people that have renal problems, it's another thing that you either have to reduce the dose greatly or talk to your doctor if it's even safe for you.
Okay. So just drinking water.
Water is ideal.
Yep. Okay. And what kind should you buy? What's the best?
Well, basically anything that's inexpensive is fine. So the brand names are Advil and Motrin, and ibuprofen's always right next to it. I would tell you if you're going to your local pharmacy, grocery store, gas station, if they've got an equivalent generic of,
if it says ibuprofen on it and some unusual name you haven't
200
heard
milligram,
of,
you're good.
It's good.
Yes, and that's there's no reason to spend more for a shiny, prettier box. So just buy the cheap stuff. It works the same. Your body doesn't care what the name on the box is. It cares what it does in the body, and that's the important thing. That's the takeaway.
Yes. So I think did we hit anything, Danny? Anything else you want to know?
I think we got her.
All right. Thank you, Chris.
You're welcome.
Good
Have a
luck
great day,
with
guys.
this.